All right, so on the program this morning, we are examining some common cancers that can cause constipation. And joining me on the phone line this morning, Dr. Bukola Oshikanlu is a radiation clinical oncologist with the Medserve LUTH Cancer Centre, and she's connecting with us on the line. Dr. Bukola Oshikanlu, nice to have you. Good morning.
Good morning, Victor. Good morning, listeners.
All right, compliment of the season to you.
Thank you.
All right, let's just jump in on the conversation. We're talking cancer, and we're doing some kind of advocacy on it. For those who might not really understand, cancer is a commonly spoken word. It's on the lips of everybody, but not everybody really understand what cancers are. So just break it down for us. What is cancer really?
Okay, cancer refers to a group of diseases. It's not one disease, it's a group of diseases in which cells acquire the ability to divide unendingly, just continue to multiply and invade surrounding structures, and they also have the ability to go far away. So for example, an abnormal growth that occurs in the breast, in one breast cell, usually starts from one cell, it multiplies into a lump of cells, and then it can invade surrounding tissues within the breast. It can also spread to the lymph nodes in the armpit, and can also get into the blood vessels and spread far away from the breast. It can spread to the brain, can spread to the lungs, can spread to the liver, can spread to bone, and so on. So usually that's what cancer is. And
right.
There are very, very many cancers.
Well, a lot of times when I speak with specialists like you, there's always no real explanation as to the cause of those cells growing abnormally. So do we have any change right now? So do we now know what could make any of those cells to begin to grow abnormally, and then it leads to cancer?
No. There's no known cause for many cancers. So usually what we have is risk factors. There are risk factors that are associated with different cancers that predisposes people to coming down with the cancer.
Right. Well, now that we are talking cancers now, so what are some of the most common cancers that we have around?
So most common cancers we have in women, breast is topmost.
Okay. So
also in women we have cervical cancer, and then in men we have prostate cancer very commonly.
All right.
And also we have colorectal cancer in both men and women, and other common cancers could include lung cancer, lymphoma, liver cancer, and so on.
So in Nigeria, breast
cancers, breast, prostate, cervical,
right,
and colorectal, those four are the top four. Yeah.
Okay. So now that we're in the Yuletide season, because I really want us to really focus more during this particular period, there will be lots of eating, lots of drinking, and the likes. And most of the time, when people come down with digestion issues, constipation is one of them, right? And for specialists like you, you're saying that not all constipations are just normal digestive issues. Some of them could be signs of some common cancers. Is that correct?
Yeah, that's correct, especially with persistent constipation. Constipation, by the way, is, when you pass through infrequently, less than 3 times in a week, and then the nature of the stools are hard and dry, and sometimes after you pass the stool, you feel like you still have you haven't passed it all. You still feel some pressure within your backside, as if there's still something there. So we have those kind of symptoms persisting for more than 3 months, then I think you need to get it checked out. You need to get it checked out, see a doctor about it. Especially if there are associated symptoms of abdominal pain, abdominal swelling, and so on.
So for those that might not understand, so what is constipation? What are we talking about here?
So constipation is infrequent passage of stool, less than 3 times a week. And the nature of the stools are hard, they're dry, they come out in pellet form, and there's associated feeling of incomplete voiding or incomplete, emptying of the rectum.
Right. So
if you have any of these symptoms, then you're most likely constipated, especially if it's going on for a long time. Yes.
Right. So on a norm, one could have normal constipation, right? So what causes it?
So constipation, commonest cause of constipation is inadequate intake of dietary fiber. So you have someone eating a lot and his food fiber content is 0 or almost 0. Give you an example. Someone is eating jollof rice with a big piece of chicken, no salads, no vegetable, no fruits to go with it. So that kind of diet all the time. In the morning you eat bread and tea. You're not having any vegetable on the side. You're not having any fruits. You're not having any apples to go with it. Lunchtime you're eating jollof rice and chicken, no salads, no vegetable to go with it. Dinner time you're eating maybe ogbono soup without any veggies, no garnish with vegetable with any swallow of your choice. So that kind of diet persistently over time will definitely make you, constipated. So, and that's not good because constipation will result in slowing down of emptying of the bowel. So, and the more that residue from your food is in contact with the lining of the bowel, the more at risk you are of having some changes going on in there that could eventually result in cancer.
Right.
So it's very, very important. One of the ways to prevent cancer, especially cancer in the bowel or colon, is to make sure that you have a healthy amount of dietary fiber all the time, at breakfast, at lunch, at dinner.
Okay.
You must have healthy amount. And also snacking. Some people, when they want to snack, they're snacking on nuts, they're snacking on plantain chips, they're snacking on potato chips. Instead of doing all of that, you could snack on fruits. You could have an apple, you can have tangerine, and other foods that are rich in dietary fiber to help you in between so that your gut is healthy and you're increasing. That way, you'd also increase your intake of dietary fiber, which would reduce your risk of constipation and also reduce your risk of having, cancerous changes going on as a result of, lack of dietary fiber that will result in slowed bowel motility and so on.
All right. So, doctor, what would you say to those that once they come down with some form of constipation, the next thing is maybe I have some food poisoning? I mean, it's food poisoning that has caused it. What would you say to those kind of people?
So having constipation is not food poisoning. Sometimes food poisoning actually does the opposite. Food poisoning would make you go to toilet a lot. So constipation and food poisoning. Perhaps what happens is when you have, sometimes when you have been passing stool frequently for some time, it's then followed by some bouts of constipation because the fact that you notice that, I'm going to toilet frequently, your brain tells you, maybe it's what you ate, and the next thing you stop eating. So because you stop eating, then the initial bouts of frequent stooling would then be followed or accompanied by no stool or constipation. So constipation and food poisoning, not likely. So if you're constipated, please. And then rather than just assume it's maybe food poisoning, just see a doctor about it so that it can be evaluated further.
Right.
And you can be better enlightened about it. And if there's any need to carry out any tests, basically sometimes, not all the time you go to a doctor that you get a pill or you get a medication. Sometimes engaging with a doctor gives you an opportunity of, being enlightened about the condition so that at the end of the day, it may just be the wrong lifestyle that may have led you to that thing. And when the doctor educates you, when you leave you to her clinic, you're better informed and you then change your lifestyle and the condition goes away. So it's very important rather than just assume, see a doctor about it.
Right. Okay, so is it all the time that, or perhaps for those who might not understand, so break it down for our listeners this morning, how many times is one expected? I mean, should you have bowel movement in a day? I mean, how many times are you expected to go do the major, as the case may be, in a day? That will be normal.
Okay, so this question, we ask this question a lot when we are evaluating patients, especially patients who come to us with complaints arising from the gut. So we ask them how many times you pass through. So this question it varies with individuals, and it varies with their dietary fiber content. So for some people, they may say, oh, I pass through once a day. Some others may say once, twice a day, and some others may say, oh, 3 times a week or once alternate days, things like that. So it varies. It all depends on the dietary fiber content.
So it's normal. So it's normal for one to go a day or 2 days without passing stool.
So if someone is going, basically constipation, if you're passing through less than 3 times in a week, less than 3 times in 7 days, then I think you should get it checked out, or you should examine yourself. How much dietary fiber are you consuming? So if you're getting less than 3 times a week, it should call for some concern. That's my opinion about it.
Right. And for common cancers that is prevalent within the tummy or perhaps the stomach region, what kind of cancers would we find there?
Okay, so cancers like colon cancer, cancers like ovarian cancer, cancers like sometimes cervical cancer, prostate cancer in advanced stages can also cause constipation. So the commonest cancer that can make a patient present with a symptom of constipation is colorectal cancer.
All right. And for this constipation that we're talking about this morning, how frequent will it occur for one to begin to suspect that this is likely going to be cancer and not just a normal constipation?
So if it's going on for, say, up to more than 8 weeks, 8 weeks or more, so I think you need to see a doctor about it and get it checked out, especially if, looking at yourself, examining yourself, you know that you're very low, you're not a dietary fiber person. You do very little dietary fiber. And or you have a family history of cancer, especially cancer of the colon. And you're then noticing that, my stools are infrequent, less than 3 times in a week, and it's been on for a long time, more than 8 weeks. 8 weeks or more, then I think you need to get it checked out.
Lagos Traffic Radio 96.1 FM. This morning we're doing an advocacy on how you can detect. We're looking at constipation as a sign for some common cancers, and our guest, Dr. Bukola Oshikanlu rather, is of course a radiation oncologist with Medserve LUTH Cancer Centre. Getting back to the road rehabilitation work ongoing at Dokpemu, just by Agbotikuyo Road. It's affecting the flow of traffic at the moment for those of you that are within that particular corridor, but we have traffic managers on ground managing the situation there. Also, we did tell you that the breakdown that we reported earlier on the 3rd Milan Bridge, that has been taken off, so it's much better. If you're heading towards the 3rd Milan Bridge, is still looking good as well. Apapa corridor, there's a breakdown of a loaded Mack truck having hustle problem. This is covering about 70% of the road there. It cannot be towed, so it has to be worked on at the moment. That's what you'll find. But the big news we've been covering all morning is the breakdown of or perhaps a falling articulated vehicle at Ojota, which is causing a whole lot of headaches. For those of you coming in from the Ikorodu end, it's a pretty slow movement right now, and that is why we are advising that those of you heading to the island, for coming out from the inner part of Ikorodu, please make use of Ajilugu, and from there you can link up with the 3rd Milan Bridge corridor. All right, let's hear from you. 08099120777 and 09153877127. If you have any questions for Dr. Oshikanlu, feel free to connect with us on the program this morning. All right, so Dr. Oshikanlu, let's get back to the issue of constipation. So how can one manage it, or perhaps what are things that one needs to do to really avoid constipation?
Okay, so topmost on the list is increasing your dietary fiber intake. It's very important that you infuse fiber into your diet all the way from breakfast to dinner, and not just one of the meals of your choice. It's very, very important that this is done. Also, you need to increase your fluid intake. For some people, they don't like drinking water. Okay, since it's a large bowl of food and you just go away, and rather than drink water, we drink maybe what's it called, fizzy drinks or other juices. So fine, if you don't like water, you can drink some juices, healthy fruit juices. Okay, not the fizzy ones. But it's very important that you increase your fluid intake, at least 3 liters of fluid a day. It will also help to improve, bowel motions that could, reduce your risk of being constipated.
Okay.
So, and then you also need to check on sometimes some medications can make you be constipated. For example, people who are on iron supplements, there's sometimes some pregnant women, and not sometimes, most times pregnant women are placed on iron supplements to help them and their baby. So those kind of medications and others could also predispose to constipation. So if you're on those kind of medications that could predispose you to coming down with constipation, then it's very important that you're tight on your fluid intake, at least 3 liters of water in a day, and you're also very tight on your dietary fiber intake. Okay, do a lot of dietary fiber, it would help.
Lagos Traffic Radio 96.1 FM 080-9912-0777 080-9912-0777. Messages here. This one says, good morning, doctor. When should constipation stop being seen as normal and become a concern? Mr. Akinlabi is sending that one in. Thank you so much. Doctor, what's your response?
Okay, so when constipation has gone on for too long, like I mentioned earlier, it's gone on for at least 8 weeks or more. When constipation is associated with other symptoms like increasing, abdominal swelling, your tummy begins to swell, or you're having abdominal pain, or you're seeing blood in your stool. For example, if a woman sees blood in her stool, it could be that her period is starting or she's on her period.
Okay.
So, but a man sees blood in his stool. A man doesn't menstruate normally.
Right.
So you go to toilet and you're cleaning up and you see blood as a man, please check it out immediately. Go to your doctor and complain about it. Or you want to observe it a bit more, you can observe. But it's very important that you're vigilant. So when constipation becomes associated with other symptoms, like I've mentioned, then you should see your doctor about it.
All right,
including symptoms like weight loss, especially if you have a family history of cancer, or you know that you are low on dietary fiber intake. And so over the years, because cancer is not something that develops over 1 year. Sometimes it takes as much as 5 years or 10 years, for these changes that result in cancer to occur. So if you're a chronic low dietary fiber consumer, you need to watch out. Especially when you develop constipation over time and with associated symptoms, you need to see your doctor immediately so you can be checked out.
Okay then, 080-99120777. This one here says, good morning, Victor. Congratulations on your Radio Broadcaster of the Year award. Thank you so much. It says, keep soaring high. Please, what other warning signs should people watch out for alongside constipation? Sheung Ibrahim, one of our regulars. Thank you so much, Sheung, for your comments and your contribution. Doctor?
Yeah, so other warning signs, similar to the first question that you read out. So other warning signs when constipation is associated with other things like abdominal swelling, like abdominal pain, like passage of blood in stool. So if constipation is resulting from, let's say, locally advanced prostate cancer in a man, you go to wee and you're not, you have to push or strain for urine to come out. You finish urinating and you feel like, oh, there's still some urine inside that hasn't come out, or you're urinating and the stream doesn't flow at once. It comes out, stops, as in you have breaks when you're urinating, as opposed to previously when the urine will just flow continuously until your bladder is empty and you feel relieved. So you're having those kind of urinary symptoms associated with constipation as a man, that's concerning for prostate cancer. So you need to see your doctor about it. So basically, when you have constipation with other associated symptoms, so you need to see your doctor about it so it can be evaluated further. All
right. Another message here says, good morning, Victor. Is constipation linked to colon cancer only, or are there other cancers involved? You didn't put your name. Thank you so much. Doctor?
Yeah, so constipation, yes, is not only colon cancer, there are other cancers. In this discourse, I've mentioned prostate cancer, also ovarian cancer is another one that can be linked to constipation. Basically, if you have any tumor in the abdomen, the abdominal cavity, because that space in the abdomen, there's bowel there, and you have other organs within the abdominal cavity. You have the liver, you have the pelvic organs of the woman, the womb, the ovaries, So basically, cancer from any of those organs within the abdominal cavity can impair motility, bowel motility, and therefore result in constipation. So if you're having any cancer from any of the abdominal organs, it can result in constipation.
Okay, then. So more reactions still coming in as we talk the issues of signs that you need to watch out for, especially as it relates to constipation during this season and its connection to some common cancers. This one here says, Doc, how can people reduce their risk of cancers that affect bowel movement? Izine from Ikeja. Thank you, Izine.
Okay, so reducing risk of cancers that affect bowel movement starts with a healthy lifestyle. Okay, so healthy lifestyle, drink enough water, exercise. Also, lack of exercise is another issue that can result in constipation. So when your job involves, being sedentary for many hours in a day, and you rush out to get to the office, you're seated all day, you get back home and you're so tired, you just eat, and next thing you jump on your bed. You do not exercise, you do not move around. That is another thing that can predispose you to coming down with constipation.
Okay.
So healthy lifestyle is one of the ways to go about it to prevent yourself from coming down with constipation. So including exercise, including drinking enough water, at least 3 liters of water a day, including improving your intake of dietary fiber. Every meal you're eating, you make sure that there's either salad or vegetable or some fruits or smoothies. Sometimes people don't like chewing. So if you don't like chewing, then juice it up. So juice up your apple, your carrots, whatever fruit you want to juice up and drink.
Okay.
So it's really by doing all of those, you reduce your risk of coming down with constipation, and it also reduce your risk of coming down with cancers that can make you present with constipation.
Okay, then. Lagos Traffic Radio 96.1 FM. Another message here says, congratulations, Victor, on your award. Thank you so much. It says, is constipation linked to colon cancer only, or are there other cancers involved? Femi Salami is sending this one in. Thank you, Femi, for your contribution. I think the doctor has I also talked about that. Somebody asked that question earlier on. Not just colon cancer alone, but of course there are some other. Okay, let's take this call. Hello there.
This is Adelusi on the line. Congratulations.
Thank you.
Just heard it while I'm driving now. I said, let me just greet my Victor.
All right.
Congratulations there. God bless you. More height.
Amen.
More height.
Amen. Thank you.
Regards. God bless you.
And you too. All right, then. Thank you so much.
All right.
Okay. All right. So, Doctor, even as we head to the finish line of the program this morning, so what are the things that we need to do during this period to ensure that we reduce the risks of contracting at least not just the cancers that are related to the tummy or the stomach, but any kind of cancer? What are some of those risks that we need to be aware of?
Okay, so for cancer prevention generally, let's start with exercise. Try to exercise at least 30 minutes a day, 5 times in a week. All right, so 30 times 5, that comes to about 150
minutes.
Yeah, 150 minutes. That's like 1 hour. No, how many hours? 2 hours and about 30
minutes. 2.5 hours.
So try to, So please try to exercise.
Okay.
It's very, very important. So you don't have 5 days in a week to do so. So you can maybe squeeze out 2 or 3 days when you cover those amounts of hours of exercise.
All right.
And the exercise should include things like walking or jogging, or if you know how to swim, swimming or cycling, aerobic exercises which will help you prevent or reduce your risk of coming down with any type of cancer, especially those of them that present with constipation.
All right.
So another thing which you need to do is increase your fluid intake.
Okay.
Drink a lot of water. It's very, very important.
Okay.
Very, very important. At least 2 liters of water every day. I don't have to drink it up all at once. You can just spread it out. Start in the morning and you finish up at any time. Some people, because they don't want to wake up at night to read, they stop drinking from, let's say, 3 p.m., some 4 p.m., or some 7 p.m. So, but just start drinking early so that you drink enough water through the day. At least 2 liters of water in day.
All right.
Also, increase your dietary fiber intake. It's very, very important. When you increase your dietary fiber intake, it reduces your risk of coming down with the most common cause or the most common cancer that can present with constipation.
All right, then.
Which is colon or colorectal cancer.
We'll leave it at that for now. Madam, nice having you on the program. Thank you so much for connecting with us on the program this morning.
All right. Thank you for having me, Victor, and congratulations on your award.
Thank you. All right, then. Thank you.
Yeah.
We do appreciate you. Dr. Bukola Oshikanlu is a radiation and clinical oncologist with Medserve LUTH Cancer Centre. And this morning, she's been able to take us on an excursion on how we can examine some common cancers that can cause constipation. We have to go. The program has been produced by Mike James. Maximum shout out going out to Kwemi Shodunke, Daniel Downsey, and Remy Aluko. And let me also appreciate our executive producer, Taya Conley. Once again, he's saying congratulations to the Traffic Radio family for the accolades coming in left, right, and center. My name is Victor Oteri. I'm out. Stay very much within. Bye.
Ogun bílẹ̀ afúnni ni wọ́n sọ